Hello and welcome to ashford.com. You are watching an interesting video on what is cohort studies, a type of medical research used to investigate the causes of disease, establishing links between risk factors and health outcomes. Please read this disclaimer carefully. Cohort studies are a type of medical research used to investigate the causes of disease, establishing links between risk factors and health outcomes. Cohort studies are usually forward-looking, that is, they are prospective studies, or planned in advance and carried out over a future period of time. A research question is raised, a hypothesis is formed about the potential causes of a disease, and the researchers then observe a group of people, the cohort, over a period, often a very long one, to detect any changes in health in relation to predetermined risk factors. For example, the scientists may ask participants to record their lifestyle factors over the course of time, and then analyze the way these correlate with disease. Cohort studies are used by epidemiologists looking into the factors that affect the health and illness of populations. Other terms for cohort studies include incidence, longitudinal, forward-looking, follow-up, concurrent, and prospective. Etiology is the term doctors use for studying the causes of disease. When doctors talk about the etiology of a condition, they mean the cause, and they may describe the mechanism by which a cause leads to a disease effect. The cohort study design is the best available scientific method for measuring the effects of a suspected risk factor, simply because the more rigorous scientific method of the randomized controlled trial, RCT, is unethical for testing the causes of disease. Cohort studies are observational, the researchers simply observe what happens, without applying any intervention themselves. Conversely, experimental studies, such as RCTs, involve an intervention by the scientists, the introduction of a drug, for example. M&T has more information about randomized controlled trials. When looking for the causes of disease, it would be unfair on participants to be subjected to the experimental design of an RCT, as opposed to the observational design of the cohort study. This is simply because an RCT would involve systematically exposing one group of people in the study to a factor that is suspected to be harmful. Randomized controlled trials are used to test the benefit of a potential treatment. While the harms of a treatment sometimes prove to outweigh the benefits, this form of testing is acceptable to the participants because the investigators are aiming at the outset to develop a new treatment. Outlining the best available study methods to answer different types of medical research question, M&T has produced an explanation of how medical research evidence is graded. Here are a few key points about cohort studies. More detail and supporting information is in the body. Cohort studies observe large groups of individuals, recording their exposure to certain risk factors to find clues on disease causes. They are usually prospective studies that play out over a future time course, they are not usually a review of past data. The Nurses' Health Study is one example of a large cohort study, and it has produced many important links between lifestyle choices and health by following hundreds of thousands of women across North America. Such research could also find social factors that influence health. Thousands of babies all born in the same week in the UK have been followed by a number of large birth cohort studies investigating medical and social factors. One famous example of a cohort study is the Nurses' Health Study, a massive, long-running analysis of women's health, originally set up in 1976, and recruiting its third-generation cohort of nurses from across the US and Canada since 2010, aged between 20 and 46 years. Numerous and important insights into health and well-being have already been gained by researchers using data from the Nurses' Health Study, which is run by the Harvard School of Public Health, and the Brigham and Women's Hospital, both based in Boston, MA. Because the Nurses' Health Study asks participants about their lifestyle choices, it has yielded much information about the harms and benefits of various factors, including specific types of food and the diet. Cohort studies are also good at finding relationships between health and environmental factors such as chemicals in the air, water and food, issues that the World Health Organization, WHO, helps researchers to investigate with large-scale cohort studies. WHO is helping to coordinate separate cohort studies so that their results can be pooled. The larger amounts of data produced in this way would enable the analysis of rare conditions such as some types of cancer. A renowned large-scale cohort study began back in 1958, and has followed 17,000 people who were all born in the same week in different regions of Great Britain. Since then, the same researchers from the UK's Centre for Longitudinal Studies have launched more studies with new large groups of babies. The latest, the Millennium Cohort Study, is following 19,000 Millennium babies, children born in the UK in 2000 to 2001. In addition to data on the health of these children and their parents, the study is also looking into child behavior and cognitive development, plus a host of social factors. Epidemiology and causes of disease are investigated by two types of observational study, cohort and case control studies. Cohort studies are considered to be better than case control studies because they are usually prospective, whereas the latter, being retrospective, are prone to the problems associated with looking back over data originating from the past. M&T has more information about case control studies. While cohort studies are graded as the most robust form of medical research after experiments such as randomized controlled trials, they are not always the best form of observational work. Cohort studies do have some limitations. They are less suited to finding clues about rare diseases, when a case control study may be better because it finds cases of disease first and then analyzes exposure to risk factors, whereas cohort studies work the other way round, following exposure data and watching for cases of disease that may emerge. Cohort studies may be less suitable to finding out why there has been a sudden outbreak of disease, when case control studies can give quicker results. Cohort studies are expensive to run and usually take many years, often decades, to produce results. As with any observational medical research, cohort studies can only give clues about disease causes and cannot give definitive proof of links between risk factors and health. References